These are some resources that we provide. So first off is an educational curriculum. So we custom make a webinar series for our cohort each year in their interests. So often this is topics like fundraising, M&A, regulatory strategies, term sheets, ins and outs of that, as well as custom mentorship. So I would say this is one of the strongest assets of our program is we have
Hmm.
about a dozen corporate partners like Zimmer, Johnson and Johnson, Dexcom. So whatever your clinical fit is where we're going to place a partner with you. Also recognition opportunities. So in conferences and other forums, we have showcase opportunities for our companies. A lot of other conferences will actually charge startups to come up on the stage and pitch. But if you make it
Right.
into MedTech Innovator, not only is the program free, but you'll get several opportunities to present for free as a current cohort company, and then later as an alum as well. And we have a very active social media presence. If you're not already following MedTech Innovator on LinkedIn, go do that right now. We have a lot of resources that are free to other startups, not even in
Yep.
in our community. This one I would say is the biggest one that folks get out of it is this peer network. I'm based in the Boston area. We have tons of therapeutics and biotech companies. Can be harder to find folks in the med device space specifically. And so having folks going through similar challenges with you, especially when it comes to, the manufacturing side of things, different regulatory pathways that aren't quite as clear sometimes for med devices, different clinical pathways, is great to learn from others. And, our community has a very active Slack channel. People ask advice all the time. Like even just today, someone was asking for, media outlets to share their press release. A lot of crosstalk happening within companies in our cohort. Other resources we have like PitchBook access. We have a great program of graduate student fellows that help out the companies. So you can think of that sort of as an intern that we pay instead of you to help you out with a specific project. And then
Mhm.
finally is the funding, which I talked about. So